Hi guys, the title of this video is Are We Being Hoodwinked? Now, I have spoken in my other videos that it is very hard to give up opioids, and in fact they're giving us agonists to what I mean by agonist is an opioid agonist receptor. I'll explain all this later, but are we being hoodwinked? Because the idea is to detox and get us to withdraw of opioids, but you'll be surprised to what I found. Again, these facts have been Googled. Some of them have come from valid and reliable resources, from reliable places like medical places. So please bear with me. First, let me tell you, I'm on Buprenorphine injections. Now, Buprenorphine, and I have difficulty pronouncing these words. Buprenorphine is buprenorphine, and I am on Buprenorphine injections once a month. Now, why I have done this video is I've had a comment from a lovely guy in the US where I did my video on heroin, and he talked about methadone addiction. He'd been on it for 3 years and wished he hadn't. So are we trading evil for evil? You know, in the perfect world, an addict would be able to give up totally, but we're not living in a perfect world. So we want to look at if an addict can't give up for whatever reason, because only an addict can give up. You can't make an addict give up. An addict has got to want to give up. So we have got to look at what we can help them with. Anyway, please bear with me. Methadone or buprenorphine, opioid receptor agonist and opioid receptor antagonist are recommended as the first-line treatments in opioid detoxification. Again, as I said, I'll just be reading this. What is an agonist? An agonist activates the opioid receptors in the brain, fully resulting in the opioid effect. That includes heroin, oxycodone, methadone, hydrocodone, morphine, and opium. And I went, ding, ding, ding. No wonder the guy's addicted, because, I'll read that again, activates the opioid receptors in the brain. Methadone activates the opioid receptors in the brain. So apparently, methadone and buprenorphine are supposed to help a person withdraw. But yet, if they're activating, again, bear with me, if they're activating that opioid effect, then you're just going from one addiction to another. Again, disclaimers, I am not a doctor, I am not a pharmacist, I am only Googling this. Anyway, the belief is that these drugs do not produce a high. I dispute this. Before I was given Buprenorphine, I was taking orally Agonist since 2014. Now, I have been on other opioids since 2004. However, I was taking Agonist since 2014. I was on 32 milligrams and was not daily getting high. So I was taking these tablets orally, and I wasn't feeling off my face. I could proceed to go about my life quite normally. However, I have to disagree with the statement from the WebMD, so that's where I went to, that says that the belief is that the drugs do not produce a high, because when I was changed over to Buprenorphine 96 UG over the month, for the first 2 weeks I was smashed. I was off my face. I was thinking these really weird thoughts and I had no control over them. I was sick. I was nauseous, and I was high. My pupils were pinned, and I was never like that with Genista. Anyway, my second injection, I did not get high, so that's quite true. So maybe it takes your body a while to get used to it. But to say that you don't get high, I got high, okay? And I'm now overdue for my third injection. According to the same, excuse me again for reading, according to the same website, oral methadone peaks 3 to 4 hours with patients maybe feeling some opioid effects, but little, if any, rush or high. Now, not having methadone, I would not know, and this guy told me he's addicted to methadone, so please leave comments below. Do you get high of subbies? Do you get high of methadone? Do you get high of whatever they have put you on replacement instead of your opioids? And that's including heroin. Anyway, let's continue. Methadone acts on the brain's opioid receptors and reduces relapse risk by preventing withdrawal symptoms and drug cravings. According to the website, people with opioid use disorder have been treated successfully with methadone for over 40 years. Okay, I wanted to know what's the difference between an opioid receptor agnostic and opioid receptor antagonist. Well, a partial agnostic opioids activate the opioid receptors in the brain, but to a much lesser degree than a full agonist. So a full agonist, I suppose, would be like heroin and stuff like that. So what they're saying is partial agnostic opioids, which is like your methadone, still activate the opioid receptors in the brain, but to a much lesser degree. Buprenorphine is an example of a partial agonist. I'm sorry, I'll spell this so you'll have an idea of what I'm talking about. I get tongue-tied. It's really hard when I'm making videos, my English accent, and some of these medical terms are pretty hard. It's an agonist, and it's AGONIST. So a partial agonist, okay? An antagonist, I can say that one, is a drug that blocks opioids by attaching to the opioid receptors without activating them. So this is why we are hooked on something that we're supposed to, be detoxing from. We're supposed to be detoxing from misuse of illicit opioids or heroin, and we're being given, methadone or like me, Buvidal, but it's still activating our opioid receptors, and that's why we are still addicts, I guess. Here are examples of antagonists. Nalbuphine. Let me rephrase that. Nalbuphine, which is a synthetic analgesic opioid that demonstrates activity at kappa receptors while acting as an antagonist at the mu receptors. From my understanding, the mu receptors is the one which gets you high. So without being because I'm not a brain surgeon or a biologist or a biochemist, I can't tell you the difference between kappa and mu. From my understanding, the mu receptors are what the opioids attach to and get us high. Please correct me below if I am wrong. I am not studied the science of this. I am just researching facts. Now, here we go. Opioid receptor antagonists include methylnaltrexone, nalbuphine, nalmethine, naloxone, naloxone, naltrexone, and nalorphine. We've all heard of opioid overdose being given naloxone, and you can actually get it now that over the counter if you. I'm not sure if you need a script because again I have not. I don't shoot up morphine. The reason I was given or am given Buvidol injections is that my doctor said I have now got a dependency because I have been using opioids since 2004. I was on at one time fentanyl patches, and fentanyl is absolutely deadly, and the opioid addicts for the reasons crave fentanyl. But again, I'm getting off the topic and I tend to do that in my videos. I'm really sorry. So I've done research again and found that yes, methadone and buprenorphine are classified as mildly addictive. Mildly addictive. So they have just changed one addiction for another. So I hope that's answered your questions, my beautiful friend Sergio. Thank you for your comment. Thank you for letting me know how the United States works. Here in Australia, where I live in Queensland, if say you are on opioids, there's what's called the authority, and to get a script of opioids, the doctor has to be trained in opioids, and he rings up the authority and you get your script. Now, only certain doctors can give Buvidol injections, and to get my Buvidol injection, I have to go to the doctor's practice, and the pharmacist races up to the doctor and the nurse gives it to me. No patient can get their hands on that because it is highly dangerous. If you try to shoot it up, you will kill yourself, because what happens is it is injected subcutaneously into my stomach, and once it's injected, it bloody hurts because it forms a gel, and that's what would happen if you shot it up in your veins. It would form a gel and you stop the blood flow. You can imagine. So thank you, because I wouldn't have done this video without Sergio. I am now quite alarmed that he has said that I have had an opioid dependency, and I agree, since 2004, and still put me on something that I'm still going to be addicted to. So in my harm reduction videos, I was suggesting that these are good, and then they are, because they are good. Ask yourself this: if you're a heroin user or an opioid user, and every day you know what it's like trying to chase your money, and the chalk and stuff in some of the opioids and shooting up your veins, and the mess and the risk of infection. So is it not better to be on methadone? I don't know. You let me know please below in comments. Is methadone better than opioids? I think it's safer because at least it's supervised. At least with methadone, the hygiene. And why I say this is, if you don't know, my husband shot up anything he could get, and he died of complications of sepsis, because what tends to happen is with shooting up, the germs, like the four particular areas: your heart, the valves, your lungs, your brain, and the bottom of your spine. And my husband was septic. He had lots of different types of infections. He had a different type of infection in his blood, a different one on his heart, and a different one in his lungs. And he did get better, yes, IV, the IV antibiotics did clear up a lot of his infection, but on the day he was due to be discharged, 8 weeks it took him, and with only a 30% chance originally of surviving, the day he was due to be discharged, he had a major cardiac arrest. 2.5 months later, he was dead. And so I honestly do not know the answer, because the drug epidemic is not going to go away. We are a society that is in pain, and drugs have been around for a long, long time. Remember the opium dens, going to escape at opium dens. So I don't know what the answer is. Maybe the answer is let us have the drugs what we want, give us a safe place to inject those drugs, so that if you want to use heroin, you use heroin, but use it in a safe place and use it with hygiene, with clean needles, and that if you overdose, they have supervised people on site where you can be resuscitated. Maybe that's what we need, is to be allowed to do what we want to do in a safe, clean environment without the law being involved. I don't know the answer. I'm just putting it out there. For me, I would want the world clean because of the damage that drugs do, the damage to your mental health especially, but that is not achievable. We cannot get the world totally clean. To do that, we would have to get rid of pain, war, trauma, and all the horrors that goes on. And being a human race, that's impossible. Love, this is my last video for Sunday. I have a smart meeting due, and take care. Bye, guys.